You are a major supporter of healthcare reform. I know you're working with the White House even. Tell us what you're doing there.
Sure. I was very honored back in June to be asked by the White House to join a team we're called the White House Team of State Legislators for Healthcare Reform. It's 32 of us from around the country, and we were asked to come to the White House for a meeting with Secretary Sebelius, the Secretary of HHS, Health and Human Services, as well as Nancy Ann DeParle, who runs the healthcare office in Washington for the president. And they talked to us about best practices in our state, what works, what doesn't work, tried to learn from us what we're doing here that they can, integrate into the National Health Reform Bill. And likewise, they also provided to us the information that the president was trying to get out. And they've asked us to go out and solicit feedback and input from people all across our states and also spread the president's message about the need for health care reform. We've done more than a dozen stakeholder meetings. We've had town hall meetings, including one recently in York, Pennsylvania, that's central Pennsylvania for some of my constituents at home, where we had nearly 600 people show up to talk about health care reform. And we heard just incredibly compelling stories. A woman who was talking to me about a pre-existing condition, and so she wasn't able to get health reform. We learned more and more every day about how our economy just simply cannot sustain the high cost of health insurance. So 22% of our families in Pennsylvania are paying more than 10% of their income toward health insurance. Something's got to change here. I believe that we have come further on this health debate in Washington than ever before. Indeed, 5 committees have marked up a health bill, and the chambers have passed a health bill. That's never happened before. Yeah. It's never happened before. And I think we're on the cusp of really seeing this through, making a huge change for our economy, for the better, and making sure that Americans who don't have health insurance have access, and those who have it now have the security of knowing that their insurance isn't going to go away if they get sick, and that their insurance premiums aren't going to continue to soar as they have in recent years. There's a lot we've done at the state level. Passing my bill to allow small businesses to pool their purchasing power so they can go out and buy health insurance at reduced rates. Passing my bill to say to primary care doctors and OBGYNs that if you agree to practice in Pennsylvania for 10 years, we'll pay 100% of your medical school loans. And those are important bills for our state, but I think we all understand that real reform, real sustainable reform to help the vast majority of people in this Commonwealth and this country has to happen in Washington, and I just feel honored to play a small role in that.
Well, you mentioned the town hall meetings that you have held throughout Pennsylvania. Representative Shapiro recently held a news conference, just about 2 hours ago, in which he talked about some of the people he met at those meetings. Let's take a look.
There was a woman sitting in the front row with 2 kids who had literally been laid off from her job that day. And she didn't have health insurance anymore. Why? Because she had a pre-existing condition. She had a rare blood disorder. She was not going to be able to go out and get health insurance because of that pre-existing condition. Or a woman who was at my town hall meeting at the Edge Hill Fire Company in Abington last night, who was unemployed, who had access to health insurance, was paying an arm and a leg for it. It's for those folks that we need to make sure national reform comes about so everybody has access and everybody has reduced costs. And the horror stories that we hear about each and every day, some of which you'll hear about in a few moments, that those horror stories go away, that we hold the insurance companies accountable, that we don't allow bureaucrats, government or insurance or otherwise, come between a doctor and his or her patient, and that we finally put our country on a position to not only do what is morally right, but what is economically necessary. Because, friends, we know that in Pennsylvania today, 22% of families are paying more than 10% of their income for health care. We know that our national economy is getting sucked up with costs in our health care system, and it is unsustainable. We have to fix that. So it's not just for taking care of those who don't have health insurance or those who are getting pushed aside by the insurance companies because of our current insurance laws, or those that are just struggling economically because of the mighty costs of health care reform. It's for everyone that we need to bring about this reform effort.
Again, Representative Shapiro, just about 2 hours ago, speaking at a news conference here at the Capitol. What do some of these stories mean to you when you hear them?
Well, I mean, you saw it right there in the clip. I mean, it's so personal. Healthcare is such a personal thing. And when these folks come and share their stories, and you realize this isn't just about, line items on a spreadsheet. I mean, this is about real people. This is actual people in our country who are suffering. and they're suffering even though they're doing the right thing. They have a job, they have families, they have mortgages. I mean, they're doing everything they're supposed to be doing, and they're still getting hurt by the existing system. We've got to change the system. We've got to reform the insurance practices in this Commonwealth and in this country, and we've got to make sure that we can sustain a healthcare system over time. This great healthcare system over time. You just saw that, and we're going to keep working hard at it.